welcome. Thank you for being here. Do you want to introduce yourself to us? Thank you.
Good afternoon. Thank you for inviting me. My name is Faye Bruce and I'm the chair of the Caribbean and African Health Network here in Greater Manchester.
Okay. With the memories that you had growing up, you just mentioned, excuse me, about how that kind of affected you in education. So, looking back on your adult life, what is the one thing that you would have done differently that would have given you more or greater satisfaction?
In terms of what I would have done to give me more satisfaction, it's really, I wanted to have done something. I would have wanted to have done something a lot sooner. So I went to university. I did my nursing degree. So I was one of the first in the country to do the nursing degree. And of course, there were 3 black students on that programme. 2 of them left or were removed. I was the only one remaining, and I think really again, you know, that environment. But I thought, you know, I'm just going to make the most of this, you know, and I really went for it. But I think really, if I would have changed something, I would have, you know, wanted to be a lot bolder, a lot more confident, a lot more sure about myself and my capabilities, because I feel that. I mean, it's all been a learning opportunity, because I think from what I know now is because of my experiences, so it's good in one sense. But I think it's really going for things and with more confidence is something that I really wanted to have done earlier on in my adult life.
Well, you just mentioned there about the other people, 2 people that dropped off. Do you think maybe if you'd had more people around you, you'd have felt more supported that were African Caribbean? Funnily, yes, I was quite close to the 2 that were there. In fact, I was very close to one person who really struggled, put a lot of it down to being black, you know, in that very, very white institutional environment. I do feel that it didn't particularly matter too much in the university. It was more in the workplace. It was more when we went out on placements. So one of the things about going out on placements when you are a nursing degree student in those days was that people didn't expect black people to be doing nursing degrees. There was very, very much about, well, okay, we're all here to do nursing, to care for patients. However, you come here with a kind of level of education that they don't expect black people to be having or to want. So it was really in the clinical environment where I struggled, because that was very, very much again around being black, with that education, people's ideas about you to start off with, and also the lack of support to help you to get to where you wanted to go. So I think had there been more black people in the clinical environment, especially as mentors, then that would have really helped. So it wasn't so much the university, it was more around in the clinical setting, because a lot of the clinical, the nurses then were enrolled nurses. They didn't have the role of mentoring students. So you were very, very much mentored by white, you know, senior nurses who didn't have your best interest at heart. They didn't want to see a black person succeed, and to come out with a degree was something.
Okay. Roll, are we ready now?
Okay, I'm going to ask you the 3rd question.
I'm rolling. Okay.
Okay. So let me just ask you about what interactions you've had with people or different groups and institutions that have given you the confidence and made you, you know, be more involved in making a life-changing opportunities for more people in the UK. So how that's maybe affected you and how you've worked with wider groups and institutions.
Yeah. So my role now is, so I am the chair of the Caribbean and African Health Network here in Greater Manchester, which started in October 2017. But prior to that, and still what I'm doing, is I work as a senior lecturer and programme director at the university, Manchester Metropolitan University. So I'm actually in the field of nursing, where it was almost problematic when I was doing my nurse training, but there is also an opportunity to help other people. So one of the things that I really thrive on within my job at the university is that opportunity to help other people to become, you know, what they really want to be. And we have many, it's very, very diverse still, the nursing programmes. It isn't as diverse as it used to be with diplomas. Now we're having all degree nursing. We have less people from diverse backgrounds because of the issues that we have in education in terms of the access issues. So, but when we do have our, students from BME, black and minority ethnic backgrounds, I like to take them and I like to look after them. And I want to give them those things that I didn't have when I was going through university. So one of the things that I find quite a lot of, and it still goes on, which is quite disappointing, is that when our students do go out to do their nursing placements, they are, again, very, very much neglected. We find that people don't manage to make it through their nurse training. And it's mostly, again, the clinical areas where they seem to fail in practice. So one of the things that I do is offer a lot of support to our students. Some of them, it's informally, but it's very, very much about what do I feel that they need. I mean, people come to me, they ask me specifically for some support, but I also look at them and I see how some of the perceptions about black people in terms of education still persist, and what can I do to try and enable those people. So within my kind of university setting, that's something that I really enjoy doing. Within the Caribbean and African Health Network, so this has been a massive opportunity for me to actually utilise what I did at my master's programme, which is very much look at the primary care trust that was, and how they linked with the voluntary sector organisations here in Greater Manchester to actually address those needs, because we talk about the grassroots community needs, the health needs. What were they doing to actually engage and to ensure that those needs were being met? And the outcome of that was that there was very, very little being done. So I took that to another level, and I started my postgraduate, my doctoral studies, which is now been written up ready for submission. And what I did is I looked at the cardiovascular, so looking at all the heart-related issues for black people. We know there's a real prevalence of heart disease within the black community, strokes and diabetes and dementia and all those different things. And looked at why is there still such poor outcomes for black people in terms of those health conditions. Why is it the white community is still making progress with that and the black community isn't? So what I did is I did some consultations with the black community around what they felt it was, and we had great discussions which brought about some very rich information around what those hidden factors were that were preventing those health outcomes from being improved. And one of the great things that have come from this is that we had the 4 weeks of consultations with the community. So there was about 133 people over 4 weeks that attended these consultations. And then we took some of the people from those consultations to form a focus group where we actually broke down and unpacked some of the themes that came out from the big groups. And some really incredible stuff has come out, and I'll be looking forward to sharing the report when it's actually done. But one of the great things that have come out is that there were the 8 people that formed the focus groups most of them now form the Caribbean and African Health Network. So it's very, very much an embedded community network that just links and engages with the community on a wider spectrum, but takes all of those issues and puts those issues into actions. We've actually looked at solutions to look at how do we address the poor outcomes that black people experience within our communities. And what it's done is that it's opened some incredible doors to link with people on strategic level. So I have, from being this girl, from being like very, no confidence in school, being told that you can't do anything, to actually engaging with people at the highest level of Greater Manchester, and also nationally as well, getting out there and saying, this isn't good enough. The community deserves a lot more than what we are given. Too often we've had seed corn funding, we've had low prioritisation around our health issues. Things have got to change. Our community is suffering and the health disparities are far too great, and we need to do something about them. So we've come with a real kind of force for change, and we're not taking yes. you know, for, you know, the things that people have taken, have just accepted, you know, small amounts of, you know, whatever that's been on offer. We've taken that in the past and we're saying, actually, we're worth a lot more than that. So we're here saying, Khan is here saying, we need change and we're going to impact that change. We come educated as well. We come as a, you know, professional network. We have lots of people that support the network, that come and offer their expertise and saying, together as a community, we can actually make a real change. So that's been a real opportunity for me to actually lead on this organisation that is really making waves across Greater Manchester in terms of looking at how do we address the poor health that we experience. Every day we're hearing about people suffering with sickle cell disease, and you know, we find actually, sickle cell, we've been here for 70 odd years in large numbers. Sickle cell has always been with us. Why have they not got strategies, practices and policies to actually address that? Why is it that Greater Manchester doesn't prioritise things that particularly affect black people? So sickle cell is not on the northwest, on the Greater Manchester agenda. It's on the northwest. Why is it not being commissioned here? We challenge the system about that. So this is what it's allowed me to do, to look at how do we ensure that our voices are heard from the grassroots level right through to the top, you know, to make sure that we can have that change.
That's amazing. Let me just ask you about looking forward, because of course we need to look back as to what happened, and as you mentioned, sort of systematic issues within clinical medicine and healthcare for African Caribbean people. So looking forward, what would you like the UK government to implement or to change in legislation that could give our people better opportunities?
The Equality Act, that 2010 Act, is doing nothing for black people. You know, that legislation in itself, I do not agree. When they changed it and they took off, you know, it's almost like putting all protected characteristics in a pot and just saying we just all need to get on with it and work to the same benchmark. I mean, I very, very much agree that, you know, I mean, intersectionally, we could be anything. I could be black, well, I am black, female, disabled, I could be, you know, LGBT, I could be all of those things. But yeah, the legislation doesn't particularly account for that. And certainly the system and, you know, organisations don't take into account that. I think there should be some adjustments to the legislation, the equality legislation, to actually take account that actually, if you look at black people, then we have our own particular needs. They are not being addressed in a whole systems approach, which is what normally people take to address inequality. That's not working, and I think there needs to be some changes around that. You know, we're just doing a piece of work which is looking at equalities, and when you look at all the organisations across, you know, Manchester, they're very much, you know, looking at single equalities, and that's not helpful when you're being discriminated against across many different sectors and in many different ways, you know, being, you know, black and female, for example. You know, so I think the equality legislation needs to be more targeted, more focused, to really address, for me, those health inequalities that will obviously impact upon people's education, people's lifestyle, the socioeconomics, all of that kind of thing will really impact. So I think that is something that I would say, if there's going to be some legislative change, that is something that I would definitely advocate for. And certainly as well, just thinking about in the NHS, you know, where we see very few senior staff within those decision-making positions. You know, we have a fifth of BME staff working within the NHS sector, and it's so disappointing to see that only something like 6.8% of that workforce is actually, you know, BME and in senior positions. So, you know, the equality legislation could make that change if they were more targeted and more focused. But at the moment, it's too general. And of course, we have all those unconscious biases and all those other things that take place as well. But the system is not going to change. You know, if you've got people that are racist within themselves, you know, if the system doesn't allow for the change, then nothing's going to change, you know. So I think that there's very, very much about, you know, we need a whole systems approach, different, you know, to actually make that change for us as a community.
So I just want to ask you about what we can do together, but also with other groups of people, different institutions, to make these positive changes to build a better future for ourselves.
We need to work together. It's all about collective action. It's all about, collaboration, integration. We can't do things on our own. We've tried. We've tried, and I say this, I can't say that I am a very experienced community worker. I'm quite new to the field of community work. But from what I know and what I have witnessed as well, just through reading and looking back, is that we're a community that is very, very much quite disparate. We don't tend to want to come together, to work together, because, when somebody gets something, when you've really been challenged to get something, people want to just hold on to it and own it, and they don't want to collaborate and work with others because there's a risk there and people don't want to take that risk. I advocate for us changing that narrative and to say, actually, that's not worked. That way of isolating yourself has not worked. So we need to be looking at how do we collaborate and build trust amongst each other to make some real impact and some real difference. So, I do it within CARN because one of the things that CARN has come together to do is to look at how do we bring organisations together to actually work more collaboratively so we have a stronger voice as well. So, that's one of the real key elements of CARN. So we often meet with other organisations that are trying to do some incredibly important work because everybody finds a gap. Organisations and people find a gap because, they might have experienced something and realise actually there is nothing there to support people that are suffering what I'm suffering or what I've suffered from. So they'll look at how do they develop that, and they'll go off on their own and they'll try to do that. And we recognise that people are doing great work, but on your own, if you're a small organisation trying to do it, the chances are that you're not going to be sustainable. So we look at how do we bring like-minded organisations together to really look at how do we collaborate, work together, effect that change that we need to see at the higher levels. So do that in the university, do that within my home life, because I do it with my children, and I also look at how do we do that within, CARN as well.
With the issues around immigration, historic issues of obviously racism, what do you think about the current Brexit negotiations, and to what extent do you feel that this will affect those of us obviously from a African Caribbean heritage?
It's really hard to say because nobody knows what's happening with Brexit. It changes all the time. But in terms of what I can see, so we look at Windrush, we look at all the scandal around that, and last year we came to celebrate Windrush. All of that started, the celebration, the preparation started before the scandal came out. And we were looking at our black nurses and our black, professions that have really held up the NHS and made it what it is. And then, of course, the scandal came and it was, mixed in with Brexit and for me as a nurse as well, actually seeing some of and hearing some of the horror stories about what's happening to people that haven't got access to health care. And for me, it's heartbreaking for most people, for anybody, but as a nurse and working alongside some of these colleagues that have been affected today, thinking, crikey, we talk about the NHS being the place of, where we care. We look after people, and at that time I felt so unproud to be part of this institution. But I think in terms of Brexit, people look at us, they look at the UK, this isn't a welcoming place to be. People are fearful, coming here because they don't know how they're going to be treated. And I think because nobody knows what's going to happen, then it's a real risk for people. And so actually what you find is people withdrawing. The decisions that people had made that they wanted to come here or even work in the NHS or work in those establishments, there's a lot of fear around because nobody knows what's going to happen to them. I mean, you're hearing about some of the stories of people that were born here that have been impacted by Windrush. Goodness knows what's going to happen to us in terms of Brexit. So I think there's no lessons learned because I can't see and hear anything that is positive that's going to impact on black people. I just think we're in a state of flux, and who knows what's going to happen. It's evident people feel now that there's a really good reason to be openly racist, because of course we had that period where it was very covert, and now people feel they can just say things because of Brexit. People can just do things. You know, people can ask those questions that they felt they couldn't ask before. But it's like almost like an open door for people to show how they really feel about diversity in this country. So that's obviously going to affect people working in the NHS, going to affect people working in all our public sector organisations. So I do feel that, you know, it's not a nice place to be at the moment. And, you know, a lot of it just depends on how prepared we are for that outcome, you know, and also, again, back to that community thing is how do we all pull together and support each other, you know, whilst this is, you know, going on and we don't know what's actually going to happen. I just think that, you know, there's real, I see our community, I see opportunities for people. It's about how we take those opportunities. How do we come forward and take them with confidence, believe in ourselves that we can actually make a difference to people's lives, to your own lives, your families around you. You know, that people, black people, like anybody else, are worthy of, you know, what's out there. We can make things for ourselves. It's about how do we take that and make the most of that, but also how do we come together and really network and show solidarity around some of those things that are, you know, challenging us at the moment. How do we come together and make things happen? Because at the moment, as I said before, we're quite, you know, disparate. You know, we don't really do that very much. But I think we can see a change. And the beauty of being part of Khan is that I can see people are coming and knocking on the door and saying, I want to be part of what you're doing, you know, which is absolutely great. And I can see, you know, some real positives in all of that. So all I say is, community, you know, there's a lot going out there, the knife crime, all the negative stuff, you know, as soon as something happens, they're ready to target black people and to say, I told you, you know, there's a lot of negative stuff, but we need to change that narrative and we need to like come together and be a lot more positive. So I can see some real changes, but we've got a long way to go. And there has been some really good stuff that's happened. But as I say, you know, we've got a long way to go to really make a difference to black people.
Can I just ask you one final point?
Sure.
Do you think there needs to be sort of more education on a global front, not just Manchester or UK, to actually show the inclusion of black people, of course, being a nurse, you know, the full history of the NHS and, of course, what black nurses, black women especially, have given to this country. Do you think maybe if there was more sort of, I don't know, more learning material for children, education, what do you think?
I can't comment too much on the global, although I worked in Zimbabwe for a year and a half when I was doing my just before I started my training, and I have been approached by a number of different countries, even Dubai, you know, to say actually with your nursing experiences, we need some of your education taken, you know, and transported into a different system. It was the same about South Africa the other day, looking at how do we model the NHS and what can you offer. So I do think that, you know, especially when I look at the Caribbean and I look at African countries, some of them that I know of, there's a lot of learning, and I would absolutely love to get out into those countries and to look at not just taking the English health system and saying, look, this could work where you are, but it's that thing about educating our people to become self-sufficient, to be able to grow their own, you know, to be able to have that infrastructure where they're not reliant, because I just think we keep feeding people things and we don't give people the opportunities to develop themselves, because it's easy to take those things away. But I think we need to instill that education into people. We need to grow and help them to grow and develop, and so that they can become more sustainable in their own countries, because it's not where it should be at the moment, and that's just simply because people just give and just, you know, they don't empower people to actually become sustainable. So we do need to look at that.
Thank you very much. Faye Bruce, thank you very much for the interview today. A pleasure to have you with us and for you to answer and give us a little insight into your personal perspective.
And thank you very much for having me.
Thank you.
Thank you.